Welcome back. February is Black History Month and a time to recognize African Americans who are making a difference. And today we welcome someone who's making a difference when it comes to health issues, particularly those that are of interest to African American women. We're so pleased to have with us today Dr. Jenna Hatcher, a professor at the UK College of Nursing, whose focus is on disparity among health in African American women. Thank you so much for being with us.
Thank you for having me.
We'll start with the basics, the definition. What does it mean when there is a disparity when it comes to health issues?
Well, a disparity basically means that there's differences in health outcomes for different groups of people. It's usually vulnerable populations have different health outcomes. It can mean different health care, but usually it's in the outcome that we're concerned with. And an example of that is in the work that I do with breast cancer mortality rates. For African American women, it's roughly 3 times that of Caucasian women. They die 3 times more. They don't get the disease anymore, but they die from it a lot more. And for prostate cancer for African American men, so cervical cancer for Appalachian women. So there's a variety of ways that health disparities, a variety of health disparities among different vulnerable populations.
So you mentioned that in some cases the population necessarily was not at a greater risk but had less favorable outcome. What contributes to that?
There are a variety of reasons that contribute to that. It's a real complex picture that keeps all of us employed by giving us work to do to try to figure this out. On a variety of levels, there's healthcare treatment in the healthcare system. There's obviously racism and discrimination. There's educational levels. The thing I deal with the most is screening. Obviously, for certain kinds of diseases, there's screening, and there's differences in access to care, which is the screening rates among different groups. So if you're not screened for the disease as much, you're not going to find out you have it in time to treat it as well as you would if you'd found out earlier.
Now, you mentioned breast cancer, one of the particular areas of concern for African American women. A lot of things in the news lately about whether or not you need mammograms. What are your thoughts on that and advice for black women to take note of?
Well, we've got some new things that came out in the news very recently from the Preventive Task Force that gave some recommendations on not being screened at the age, starting at the age of 40, like women have been hearing. But the American Cancer Society and the National Cancer Institute and myself and most other professionals still agree that women should be screened starting at the age of 40. This is especially important for African American women because we tend to get earlier, more aggressive cancers. So if you're getting that earlier, more aggressive cancer, you've got to be screened for it because for one thing, it's more deadly. You'll die a lot quicker. And for another thing, it still can be caught early and treated properly. So it is imperative that women in their 40s still get screened starting at the age of 40. The American Cancer Society recommends that you get screened every year and that you have clinical breast exams every year. And all of the guidelines are still pointing to that being recommended.
Well, some very important advice, and I know we were talking earlier that if it is an issue of financing, the health department, there are a lot of resources that can offer that assistance for screening, treatment at low cost or no cost if you qualify.
Yes, the health department has a sliding scale, and it's important to get the screening there because if you're screened there, the follow-up is provided through the health department. So in other words, if your cancer is detected somewhere else, it's more difficult to get the financial follow through on your care, but if you're screened through the health department, then all of your care and treatment, if you should have cancer, comes through the state programs and the federal programs that the health department can offer.
Well, thank you so much for sharing that information with us. Again, Dr. Jenna Hatcher from the UK College of Nursing. We thank you for your time today.
Thank you.
We'll be right back with the Last Check Your Forecast.